The latest data on Covid-19 covers a 2-year period from the start of the pandemic in March 2020 to February of this year. The CSO data looks at all registered Covid deaths up to February this year, showing that Covid-19 was reported as a medical condition in 6,255 cases during this time, but identified as the underlying cause of death in 5,384 cases. What this means is that Covid is the condition that kick-started a chain of events that ultimately led to death. The CSO data also showed that 4 in 5 deaths from Covid-19 had at least 3 other medical conditions mentioned on the death record. The largest number of accompanying conditions of Covid-19 deaths were diseases of the respiratory system, reported in 98% of cases. Pneumonia was certified as a condition in more than half of the cases. 91% of Covid-19 deaths occurred in people aged 65 and over. More males died due to Covid-19 than females in this period. 53% were men compared to 47% women.
There was 183 deaths, or 3.4% of them reported Covid as a single cause of death, whereas there was 5,201 deaths, or nearly 97% of them, certified as having Covid and at least one other medical condition on the death certificate.
Consultants say older people need more supports.
What Covid did is that it exposed some of the vulnerabilities we know exist in our health service, in particular with regards to community supports for older people, community supports for people living with chronic disease, even if that's just ischemic heart disease or respiratory lung disease.
Chronic heart disease and diabetes were also conditions experienced by people who died with Covid-19. Dimitri O'Donnell, RTE News.